Welcome to Expert Voices in Dementia, where thought leaders from the field present insights from dementia research, clinical practice, and caregiving that will help you maximize the quality of life and well-being of your patients. In this episode, Dawn Brooks, PhD, Global Development Leader at Eli Lilly and Company, and John Sims, MD, Senior Medical Director at Eli Lilly and Company, discuss recent data analyzing the real-world implications of Donanemab treatment for people with Alzheimer's disease.
Tell us why it's important to look at the real-world implications of Trailblazer ALZ 2.
We did a lot in this study to actually try to reflect the real world in the study. So, in fact, we have, of all the studies that have been done and have had FDA approval, we have kind of some of the least number of exclusions. We have kind of a very broad range of co-pathologies and people on medications that are common for the elderly. In fact, we've even looked at comparisons to Medicare populations, which has been, of course, of interest. And about 50% of the people in our trial actually would not have been eligible for the other trials that have been approved. So we think it represents a very broad spectrum of the real world. And so I would anticipate that the real world will probably look very similar in what we see from the trial, right? Like it's not a super hyper selected healthy only population of which then you're surprised by what you find in the real world. So I think generally speaking, diagnosis in the real world has not happened, right? So for us, we use PET scans for everyone to get in, and not everyone has PET scans. And so when you use PET scans versus CSF, which is kind of the other diagnostic tool, it enriches a little bit for higher pathology than by CSF only because CSF is a little more sensitive than the amyloid. So I would anticipate that depending on how people enroll their patients or looking at inclusion, whether it's CSF or PET, you might get a slightly different population, and you probably can get a little earlier population if you're doing CSF. The good news is that earlier is good for amyloid therapies, right? If anything, amyloid therapies are kind of first-line therapies in this disease, since the amyloid is the pathology that comes before the tau pathology, which is an important pathology to also address. But certainly we think that in intervening earlier in the disease and the data that we've generated is helpful. So right now, the diagnostic milieu for Alzheimer's disease is making diagnosis way too late. And many people are not getting a diagnosis. So I think that's the other aspect of the real world that we'd like to see evolve from today, and that is to take people's complaints seriously, people to not think that forgetfulness is just normal aging, because it's not. And to also, Lilly's working on providing other diagnostic opportunities for people, including blood, which we've announced with doing some stuff with Roche. And we think that's probably really key to unlocking the real world and the diagnosis and looking at people.
Good. I would add in terms of the results that we saw from Trailblazer 2 and how to think about those in a real world application and maybe what does that mean that's meaningful to patients and meaningful to their caregivers, their partners. And part of that's why you see us trying to express the results maybe in ways that take it out of a kind of a scale, right? That's a little bit hard to kind of get your head around. What does so many points difference and slowing, how do I actually think about that in terms of if I have a loved one that is living with Alzheimer's disease, like what does that mean? And so we tried to do that across a number of approaches. One was to say that all of the domains or the aspects of these scales are being improved by donanemab treatment, right? So the scales will look at things that are related to the cognitive function, right? How are you doing some of your thinking skills, but also related to function, which is another aspect, unfortunately, right, that declines with Alzheimer's disease. So whether it's assessing your orientation and ability to kind of remember appointments and things, but also looking at, am I still able to be home alone? Can I still have some independent functioning as you would expect in these early stages? That's where we translate that into kind of more that everyday aspects of how do I live my life And those are things that are measured by the scale, but we're able to kind of show those then with donanemab to say, like, these are real things that I'm still having benefit from with donanemab. So that's one aspect. The other is translating a bit these results into things that are time-based, right? So when you say, okay, if I was treated with donanemab compared to somebody who's not treated with donanemab, right? And I have a progressive disease, unfortunately, with Alzheimer's disease, it's continuing to progress. At the end of this 18-month study window, how much less progressed am I than somebody that had not been treated at all? And we converted that into time and said that over that year and a half, I'm 6 months less progressed than somebody that wasn't treated at all. And if I mentally think about that over living my life for the next 5 years, right, you just put someone on a different trajectory, right, that kind of keeps them in those earlier stages longer. And that we also looked at by the reduced risk that you have of moving into the next stage of Alzheimer's disease. So that was kind of a third way we complemented this and translated it into that kind of everyday real world. Alzheimer's disease only has 4 stages. You're at mild cognitive impairment, mild dementia due to AD, then moderate, then severe, then unfortunately it's fatal, right? And I think people sometimes regret that kind of the stark reality of this progressive disease. And so we looked at, does donanemab reduce your risk of progressing into that next stage of disease, which means that you're much, much more advanced, right? And so that reduction is 40% reduction of progressing to the next stage of the disease, for example, was another way that we tried to say, hey, let's put this in real world kind of framework in terms of the longer I can keep you in mild cognitive impairment, which is stage 1, the better off you are. And we hear from patients, hey, I've adjusted, I'm living a great life here in these earlier stages. I'd love to keep it there longer, right? And not get into these stages where I become dependent on others and can still kind of enjoy activities, enjoy my family, the hobbies I've always done. And so that keeping people in that earlier stage is another measure.
On that, the other thing that we built in there is something we thought would be an easy conversation with a physician. So we pre-specified an outcome, like how many people, what percentage of people treated with donanemab didn't change for a year, right? So on the scale, so as a progression, and almost 50% of people treated with donanemab didn't have any change or were stable for a year. So while we certainly don't expect us to stop the disease with just a single drug, that is another output that we pre-specified as an outcome that could be a conversation in the real world, right? Mm-hmm. Like we expect about 50% of people treated may be stable for at least a year. I think one of the questions is can I leave this person at home? And that was significant. And that means that you're now impacting 2 people's lives, right? Because of the caregiving burden that comes with taking care of an Alzheimer's patient means that the person often can't do things for themselves, go out and do their own chores, has to take someone with them, or he has to drive them, or is fearful of leaving them at home. And I think that's when I saw that data, I was super pleased with that ability to maybe impact 2 people's lives with the treatment of one person.
Thank you to Drs. John Sims and Dawn Brooks for sharing their knowledge with our listeners in this episode of Expert Voices in Dementia. And thanks to you, our listeners. Be sure to visit theneurologyhub.com for more podcasts in the field of neurology. Expert Voices in Dementia is brought to you by the editors of Practical Neurology.